Hi, sir. So I kind of want to just go over a few things that I think that maybe we could kind of touch base on, just kind of give you maybe some more information on what's kind of sticking out to me in a sense. So one thing is the blood pressure. I did see that you do have a family history of hypertension. So today your blood pressure reading was 142 over 98. The normal range is 120 over 80, and a lot of different things can factor into a higher blood pressure. I did see you liked energy drinks, so sometimes if you drink too much caffeine, that can kind of increase your blood pressure. Or maybe even it might be more of a chemical imbalance in the body, and you can't really tell sometimes. So going to see a medical professional might help just to kind of touch base on the high blood pressure today, and maybe if there's anything that they can kind of help out with that, then they can give you that information or give you more information about your body for the high blood pressure, okay? The next thing I kind of wanted to talk to you about was the hard bristled brush. So usually we really like to use a soft bristle brush because sometimes we don't realize how hard we're brushing to begin with. And so if we're using a hard bristled brush, that can kind of increase more trauma on the gum tissues than it can do good. And sometimes people think, they really want to scrub hard and really remove all of the plaque and everything. But you could be removing the plaque, but you can also be damaging the gum tissue. And the gum tissue cannot grow back, so we don't want to cause that recession. And so with that being said, let's try to change to a soft toothbrush. I'll give you one today. In general, it would be very beneficial electric toothbrush because the electric toothbrush can actually remove a lot more plaque buildup. So it's actually, you can feel the difference after you use the electric toothbrush one time. And so that'll actually make it a little bit better if you are only brushing one time a day. If you can even gradually start to increase that, maybe here and there, brush twice a day. And if you do brush once daily, I would really recommend you trying to at least brush at night rather than just in the morning, because everything you're eating and everything you're drinking on a day-to-day basis, whenever you're falling asleep and your breath or your mouth is getting kind of dry while you're sleeping, all of that plaque and all of that food debris is just getting stuck on your teeth, and it's going to be a lot harder to remove that over time. So just try, if you're going to only brush one time a day, really try to brush at least at night. So then once you're sleeping, you get kind of your gum tissue can kind of breathe and just kind of recover. And obviously we want to brush 2 times a day, but the more you can increase it, the better, and the more easy it'll be to become a habit. Another thing that we can talk about is actually, those high energy drinks that you do drink, or even Coca-Cola, orange juice. So I did see that you drink this several times a day. And I understand, these are some great things that, we all like to drink. I love my Diet Coke, so I understand. But something that can kind of help your teeth in the long-term basis is because all of these drinks do have a lot of acid in there. And so this can kind of cause your teeth to get a lot less strong. And so over time, if we just keep drinking over and over and over again these acidic drinks, after we take that sip of the acidic drink, the acid exposure is continuing at least 20 minutes after you take that one drink of one of these acidic drinks. So if you're going to drink one of these, honestly, if you just try to drink it all in one sitting, that'd be a lot better than just drinking it over the day. Because if you're drinking it over the day, you have so much acid exposure in your mouth, and you're not diluting that in between. So another way that you can help that out is to dilute it with water. So if you are gonna drink your coffee over maybe an hour basis, just kind of have some water after you do drink your coffee, just another little sip of water. It'll dilute that acidity in the mouth so it won't be as harmful to your teeth, okay? And I do know that you do want whiter teeth. So what we're going to do is we're going to make sure that we get back to this whole whitening of the teeth, because I understand it's a very big deal for you, especially before your wedding. But one thing that we do want to do is remove all of the plaque, remove all of the calculus before we get to the whitening, because we can't whiten on top of calculus. That calculus is going to get removed. There really is no reasoning for that if it's honestly something that needs to get removed before we whiten, okay? So we're going to get your cleaning done for you. And once we get your cleaning done, we will ensure that we're going to give you a medical or dental referral, maybe to one of the general dentists. So then you would be able to request getting maybe a bleaching tray and some bleach for that, okay? If I can make it for you, I definitely will. We will just figure it out for you, all right? Thank you, sir.